Okay, good afternoon, viewers. Sorry for the slight delay in coming online. We've just had a small technical, challenge. I want to welcome you back to the program, Monitor Your Health, where we enlighten the public on common and contemporary medical conditions. Can I welcome you this afternoon? The topic is an interesting one: common colds in children and surgery. My name remains Dr. Femi Ogunremi, and I have in-house with me Dr. Oyedepo, an anesthetist. You're welcome, sir.
Thank you very much, Dr. Femi Ogunremi.
Thank you. Can we actually know you? Can you introduce yourself to us, to the audience?
Yeah. My name is Dr. Olarewaju Oyedepo, a senior lecturer and senior consultant anesthesiologist with the University of Ilorin and University of Ilorin Teaching Hospital. Currently, I'm in King Salman Specialist Hospital, High, Kingdom of Saudi Arabia, as anesthesia consultant. Where I'm spending my sabbatical.
Right. Thank you so much. And can I actually congratulate you on your recent award as the hero of COVID?
Thank
you so much. We're really proud of you. Thank you. So the topic today is common colds and surgery in children. Before we actually go into that topic, please, who is an anesthetist? What does it mean to be an anesthetist, and to be under anesthesia? Okay.
Before I define who an anesthetist is, I need to define what anesthesiology is. Anesthesiology is a branch of medicine that specializes in using drug to render a patient unconscious to surgical stimulus. Unconscious does not mean that the patient is always asleep. Sometimes we use drugs that they are unaware of surgical stimulus. That's anesthesiology, the study of drugs involved in rendering the patient unaware of surgery. Okay?
Right.
So anesthesiology is a specialist that specializes in the use of drug to ensure that patient is unaware to any kind of surgical stimulus. Today, we see during the time when Eve was created by God, we were told that God caused a deep sleep in Adam. Okay, so God is the first anesthesiologist that ever lived. Okay, so anesthesia can be divided into two. The reason why I said that we don't need to think that all the time patient has to go to sleep. Okay, sometimes we just give a little injection to a particular area to be able to carry out surgery, or a particular region, or the whole body by putting the patient to sleep. What are the things that we want to ensure during anesthesia is that we want our patient not to be aware, which is called amnesia. We want our patient not to feel pain, which is called the analgesia. We want our patient not to move, which we call akinesia. So we call it triad of anesthesia, which is called the haze of anesthesia. So those are the things that we make use of in anesthesia.
Right. Thank you so much. So now, I know for sure that our children, because one thing that really worries a parent is when your child needs to go under the knife. And it's usually a very challenging period. I've been privy to situations where a parent will bring their child to the hospital for surgery, and the anesthetist will strongly kick against the surgery purely because the child has got common cold. What is that all about?
Yeah, thank you very much. I want to again tell you that when you say anesthesiology, we are the doctors at the background during surgery. And I must tell you also that we are like pilots because we are involved in putting the patient to sleep.
Yeah.
And also waking them up at the end of surgery. Surgeon can cut anything. But if anything happens during anesthesia, catastrophe will occur. So in anesthesia, it's all about safety. So we say safety first. So therefore, when we know that it is not good to fly, then we say, okay, let's postpone until weather is clear. So that's what the anesthesiology is all about. And what we do when we have such patients coming for surgery and we find them having common cold, then we examine and see, is it safe for us to put this child to sleep or not?
Right. So, I mean, this is quite interesting because, you know, common cold is common cold. We have this many times a year. What is, I mean, common cold is an upper respiratory, you know, airway infection, just an upper respiratory airway infection. This is the way people see it. Why does it become a big thing in your hand? Why do you then become so, you know, in a way, sometimes we look at it as you're so antagonistic of the surgery. Can you break it down to us? Because I've had parents come and they complain bitterly about this. Maybe there have been things they've arranged, you know, for a small surgery to happen. The parents might live somewhere very far. They might, I mean, maybe one of the parents, they might have arranged leave, they might have arranged things, and they come home. Why? Just ordinary cold. Is there nothing to be done, or why is it so big in your hands? We really want to know.
Thank you, Dr. Just as I've said earlier on, there are two parts to anesthesia. One is for the patient to be awake. The second part is for the patient to be asleep. We are worried carrying out anesthesia in children because most of the time they cannot tolerate being awake while surgery is being carried out on them, except it's a young adolescent. Okay, so most of the time, the technique of choice in that wise is that we put our patient to sleep. So because of that, anesthesiologists, we put our patient to sleep by invading their airway, which is the nose, the throat, and the windpipe to the lungs. So that's where we work. That is our territory. So therefore, if there is any problem within that airway, we need to be very careful because catastrophe can occur. I must tell you that then the other thing is that common cold in children is very common in the sense that during falls and during winters, they have repeated catarrh, cough, and pneumonia. At this period of time, it is not safe for anesthesiologists to invade the airway because the patient can develop post-operative pulmonary complications, and that can be catastrophic.
So when you talk about post-operative pulmonary complications, what is this? What does that mean? To me, the child has got a cold, is the nose.
Yes.
You're talking about post-operative pulmonary complication. What is that? Because to a parent, they can see the child has got runny nose, just mucus. By the time I give, what I would do normally in the house is to give them warm water, give them aspirin, keep them warm. If they have headache, we give them paracetamol and make sure that they rest a bit and they get better. So where are we coming to pulmonary complication? What does that mean?
Okay. just as I've said earlier on, during Qatar or during the influenza common cold, which I will say upper respiratory tract infection is what we call in medical parlance, but because we are talking to the audience for them to understand, anything happening, whether in the nose, in the throat, or in the trachea, or in the lungs, okay? We talk about airway infections, which can be upper or lower, okay? So when there is airway infection, okay, there are many things that have been postulated that once there is airway infection and patient is being put under anesthesia, they have what is called hyperactive airway.
Right.
So this hyperactive airway involves a lot of theories that have been put forward. Why is the airway still being hyperactive? It is said that there are chemicals that are released to cause this airway to be hyperactive. Apart from that, they have also said that even the wires, that is the nerves, supplying the airway, okay, also secrete certain hormone. But during the incidence of common colds, these chemicals are being inhibited. So therefore, the airway becomes reactive. Another thing is that even within the airway, we have some muscles, smooth muscles, okay? And these smooth muscles become very sensitive during this influenza or upper respiratory tract infection or common cold.
Okay, thank you. Okay, so we can kind of relate with what you're saying now. That when there's an infection, we just see just simple infection. What you're telling us is this infection is not just an ordinary infection we are seeing. There's something there deep down in the airway that might happen. And you mentioned something about hyperactivity. I know you've discussed about, nerves not working well. There are chemicals produced, or some need to produce, they're not being produced because of business and things. So what is the implication of that on this child that we have brought to you? What's the implication? I know when they're under the knife, you're taking control of the airways. Does he have something? How bad it is? How bad is it if we leave this hyperactivity on that would then warrant us canceling, important surgeries?
Yeah, thank you very much. The complications that we call pulmonary complications can range from mild complication to very severe one. Okay?
Right.
And one can lead to the other. One of the complications that a patient with upper respiratory tract infection can develop is having laryngeal spasm.
Right.
Larynx is the first part of the upper airway. It's like the gateway of the upper airway. It's the organ that we use in breathing, and it's also an organ for talking. So this organ has some muscles and cartilages that when an individual with upper respiratory tract infection becomes suggested under anesthesia, then the gate can get closed and air will not be able to go into the patient. And because of this, the patient can get out of oxygen and patient can die from that. Another thing that can occur is that even within the lower airway or the smooth muscles like the bronchial, we have bronchoconstriction can also result from hyperactivity in patients with upper airway, which can also have a deleterious effect in oxygen passage into the tissue and into the patient and resulting in problems. Sometimes, some patients can develop terrible complications from this hyperactivity. That's what we call negative pressure pulmonary edema because of the increased pressure within the upper airway, resulting in closure, that individual can develop pulmonary edema within the lungs. Because we know the lungs and the alveoli, we know that that's where the exchange of oxygen to the tissue and carbon dioxide out of the tissue occurs. But in such situation, the membrane becomes distorted, and therefore there will be poor delivery of oxygen into the tissue, and patient can die from that. And that can be evident in the airway, in which we see the patient giving reddish sputum during surgery.
Right. That sounds, I mean, obviously we started with, it's a common cold. My child is had a common cold. And the way you are breaking it down, the way you are going, I'm just following you, and I'm following you through. You started from my nose, you're going into my throat. From my throat, you're going into my windpipe, and then you're going into my lungs. So it means this must be a very serious situation. Now, I know that a lot of the time, when a child comes in with, common cold, it's usually a viral infection. Does it mean that all viral infection, or does it mean that it's just any infection in the upper airway will result in things like this, that we have to be panicking about what can happen if a child needs, to go under the knife?
Okay, thank you very much. The common cold, most of the time, is caused by viral infection by about 95% of viral origin. Okay, particularly rhinovirus. Okay, about 30% to 35% of patients with upper respiratory tract infection, the rhinoviruses are the culprit, okay, of all the viruses. But generally, it is about 95% viral. The remaining 5% can be bacterial in origin. Okay, so the symptoms that these patients present makes it very difficult for you to say this is viral, this is bacteria. So they present with cough, okay? They can present with sore throats. They can present with nasal discharge, which can be clear discharge or purulent discharge, okay? They can be present with productive cough. And some of them can present with sneezing, just ordinary sneezing. Right. Then fever is another symptom that they can present with.
Right. So when they present with all these symptoms, because to me, everything that you've talked about is what my child will come up with when they have common cold. Is it all the time that they have this, that they can't go under the knife, that they can't have this surgery? Because the worry is we have common cold, we don't even know what to do. We rush to the hospital because they say the child needs an operation, maybe an elective operation, maybe an emergency operation. We know that this operation is as important to me as, my child as well. So I've gotten here, you've looked at the child. So every time, in fact, somebody is just asking a question, that there are children whose nose will never dry. Their nose will always be running. Okay. Is it all the time that they will never have to go, they will never have to have this surgery? Or how does it work?
That is the dilemma that we are facing as anesthetists. Most of the time, in adults, we have about 2 to 4 times episode of common cold. But in children, the frequency of attack is about 6 to 8 times. In fact, some say about once in every month, which means throughout the whole year, they are likely to have common cold or upper respiratory tract infection. So we try to say it becomes very difficult now for us to say that the patient should not undergo surgery. Okay, so therefore, what we do is to be able to assess the causative organisms and the impact of that common cold on the child, on that particular child. So is it a mild infection or is it a severe one? In a mild infection, you have just only clear nasal discharge without fever, okay? But in other cases, you have cough, you have purulent discharge. This becomes very complicated. In such situation, you've got to treat the patient and ensure that the patient is clear of infection for at least 4 weeks before coming for an elective procedure. But if the surgery becomes an emergency, then we have to ensure that we take all precautions and we must prepare to manage whatever complications that comes. But we make sure that we ensure that we don't allow any complication to occur by allowing an expert to manage this patient.
Right. Thank you so much, Dr. Oyedepo. This is quite enlightening. And, to the viewers at home, I hope you're, grabbing one or two things from this conversation, because it's quite important. We believe that a lot of parents get worried when an operation is canceled. From what we're gathering from this, discussion, it sounds to me like, as simple as it looks to us as parents, it might be so important for your child. And sometimes we become very impatient because we really feel that this operation needs to happen. But what I'm gathering from the discussion we're having here is, sometimes it might mean a matter between life and death. And you need the experts to actually advise you on that. The time that we've taken out, it can be, we can apply for such time. But in a child that's, then we decide to go for surgery. What if the worst case happens? What if we lose the child? That's not our prayer. Anyway, in order to link us into that, can I ask Dr. Oyedepo? We've talked about viruses causing things. Are there other things that might actually mimic, such presentation, like when a child will start having fever, cough, sore throat, discharge, without being a viral infection? There is bacteria that covers about,
yes,
just a small percentage. Are there other things?
Okay. I want to tell us that there are many things that can look like upper respiratory tract infection. Okay. And we can have non-infectious condition.
Okay.
Like allergic rhinitis. Like some patients are predisposed when they are exposed to dust, smokes, danders, animal danders, and grasses. Okay, so during winters, some of these patients can also present with nasal discharge. Okay, but you've got to ask from the parent whether this is the usual thing, whether there's reddening of the eye, whether there's asthma. Okay, so these in the family. So this can also be a differential diagnosis or something similar to common cold, whereas it's actually not common cold. Okay, in such situation, what you need to do is to use some drugs that will also limit the patient from developing an attack. Okay, so another thing is asthma itself is also a problem. They also have upper apparatic airway. And what we do is that even for elective procedure too, we make sure that we control their asthma before they undergo elective procedure, elective surgery. Then foreign body, some of the child can inhale peanuts and continue to cough, because they have said that one of the symptoms is cough, and it can become purulent because if the foreign body has stayed for some time, you see the child having a discharge. So therefore, you must also not forget that this can be a differential diagnosis of common cold in that child. Some children, when they eat, they regurgitate what they eat, and that can also mimic, and that can irritate the airway, and they can present with cough or sore throat. So these are the non-infectious conditions that can cause common cold. Another infectious, there are other infectious conditions that can affect the airway, like epiglottitis. People call it belu in our own parlance. Okay, right. So this condition can also be Streptococcus infection, which is bacterial in origin, can also present with upper airway hyperactivity. So in such situation, what we need to do is to treat the patient with antibiotics. Herpes simplex can also be a differential diagnosis. Okay, bronchiolitis in children is also a differential diagnosis of common cold. So by and large, these are the differential diagnoses. However, I must also tell us that there are some surgical conditions that can predispose the individual to having recurrent upper respiratory tract infection. And such condition can be this adenoid enlargement. There's a lymph node that drains the throat, okay? And that thing gets swollen, okay? Right. And block the nasal opening and causes repeated upper respiratory tract infection. And this can affect children, especially the infants, when they have this repeated infection as a result of this blocking. It can affect them in terms of growth, like a 5-year looking like a 3 years old child. And this can also lead to a more complicated condition, having what we call right heart failure. From right heart, the heart continues to fail because of the poor oxygenation. They sleep, they snore at night. Parents will see them, they do like at least they are not breathing, and they get worried. And this condition can also predispose them to having recurrent upper respiratory tract infection, which we need to, this surgically amenable condition that can take away this recurrent infection, aside from the environmental condition.
Wow. Thank you so much. There's quite a lot of things in there. So, okay, so we know now that it's not only viral infection that can present in this form. We can have other things that can also present that will be similar to, hyperactivity of the airways. Now, maybe we should just have a short break, like maybe 1 minute, to talk about our sponsor. That's AreaDoc. I would have loved to play a video to you, but I'm so sorry to the audience tonight. I've not prepared the video, so I'm just going to talk us through AreaDoc just briefly before we continue with quite a lot of questions from the public that we're going to trash this evening. So AreaDoc is an app which actually is sponsoring this particular program for us. It's an app that an individual can download anywhere you are. It's called AreaDoc. If you look at the back, you can see the logo there. So it's AreaDoc, one word, no space. You can check it on Android or iOS stores, and it's there. So when you download AreaDoc, you have the opportunity to chat with doctors free, and you can call doctors free. You can also get your treatment, or you can get your treatment through the app. You can get specialists if you go through the symptoms checker, where it will ask you some questions in form of algorithms, and it gives you a provisional diagnosis. From there, doctors, specialists that are registered on the app, you can have access to them and you can interact with them directly. Or if you want to search for things like maybe pharmacy or maybe laboratories, you can actually do this if you go to the left side where, of the app. And then if you then chat with doctors, if you need to have intervention, like maybe prescription, can do prescription through the app. We can also request for investigation. We'll refer you and signpost you to accredited, partners and service provider through the app. It's quite robust, and there are a lot of free things that you can get in there. You can download it now by just searching for AreaDoc, AreaDoc, one word, and then you begin the journey to free medical advice. Thank you so much. So, Dr. Oyedepo, I think I've done the due diligence I'm supposed to do for our sponsor now. So now, what we need to, let's ask some of these questions that people are asking from the public. So somebody said that, with all this said, can a child die from common cold or from its complications?
Thank you very much. During anesthesia, a child can die from common cold because the complications of common cold can result in pneumonia, and if it's not well treated, children have died from pneumonia. Okay, and that is why we as anesthetists want to ensure that these children are in optimal condition if they are coming for elective procedure. It is said that for patients with common cold, they should be treated and be free from symptoms for at least 6 weeks. But it becomes very difficult. It's become very difficult to allow them to wait for 6 weeks. Okay? One, because recurrence of upper respiratory tract infection is very high. It means that they will not have their surgery. Okay? So we can, in our environment, because what we do is to ensure that we treat them for at least 2 weeks and come for surgery. But that is not the ideal. But because of the environmental condition, the emotional problems, as you have highlighted before, on the parents, in fact, some of them can go to a quack to do the surgery because you refuse to do the surgery, and they can die from that place. So I can say they can die from common cold if they will go to an individual without optimizing, and they anesthetize the child, and child goes into laryngeal spasm, and they are not able to manage the laryngeal spasm because of inability to manage that patient. Then that patient can die from that. Okay, so what you call common may not be common at this point in time. So a child can actually die either from laryngeal spasm or from bronchospasm, or can die as a result of developing pulmonary edema that same day on that spot, or can die from pneumonia weeks even after surgery because the thing may not be adequately treated. So the child can die. But by and large, if you go to an expert, it is said that once we know how to manage this condition, then the individual is safe. But we give guidelines, just as I have said earlier on, based on the age of the child. Okay, how old is this child? What is the level of this infection, the common cold? I've said mild, that's what we call mild, and then we have the severe infection. In such condition, if it is mild, you want to go ahead. Okay, if it is severe infection, you want to postpone. Then also, apart from that, the surgery that the patient is going to undergo is also very important. If it's a peripheral surgery that you don't need to invade the airway, maybe what we do is just put a mask and the patient starts to inhale our drug and goes to sleep. And it's going to last just about 30 minutes or 1 hour. In such a situation, you can go ahead with the surgery.
Right. Okay. Thank you so much. So I guess that is why you're actually worried that you cancel some of the surgery, because there's a risk that's playing with somebody's life during the decision-making process. So now let's take one more question, and I ask one other question that I have here. So somebody said that, what do you do to a child that their nose never dry? They always have colds, year in, year out.
Okay.
What do you do? Is that an appropriate question for you?
Yeah. I must disclose at this point in time that I'm not a pediatrician, nor am I an ENT surgeon. But when the nose of an individual or a child is never dry, you want to look at it. Is there a problem within the airway? Just as I said adenoid hypertrophy. Some of them can have polyps, okay, in the airway. So the nose or the airway, upper respiratory tract infection, needs to be examined by the pediatrician or the ENT surgeon. There are certain investigations that you need to do. You may need X-ray of the nostril or the upper airway, the skull generally, to look at the upper airway, okay? So the ENT will be able to see whether there is obstruction to the flow of air and mucus within the airway, which needs surgical intervention. So that is one. Then you may also need to take swab, okay, of the nasal passage to see what is the organism causing this, okay? But usually these are not usually indicated for patients with common cold, okay? But you want to rule out other pathology, you will need this investigation. Complete blood count is also very important. That is, the white cells. You want to see whether it is viral in origin or whether it's bacterial in origin.
Thank you so much. So to the person that asked this question, I hope you got in it there. Obviously, if you have a child that is running year in, year out, it could be one of those things. A polyps is just a tissue along the track of either the nose or a bit higher up that is protruding and is just dangling out. The body sees this as something that is irritating. It keeps fighting it. So it will never dry because it wants to fight and pull it out, but it can't because it's there. So until somebody they have a look and they can see whether that's the problem. If that's the problem, that can be tackled. And also, like Dr. Oyedepo told us about the adenoids, there's some lymph nodes there, especially in a child. And those lymph nodes, they're fighting all the time, to prevent infection or to fight infection, and it becomes swollen, and they can then sort of block the airway or cause some, irritation in that area. So if your child is going through this, you need to seek advice. Again, don't forget, AreaDoc you can actually call and ask for advice. They might be able to signpost you into the right direction where to go from there. So now the last question here that somebody's written is quite long. It said, the olden days, grandmothers use the method of hot water and menthol to dab the chest of a child who has cold. Does this pose risk to the child, or is it a wrong method of treating common colds? Then goes ahead to say, grandmother also will use wet cloths on lanterns to achieve such. Can this work?
All those techniques are something that people have used before, but they are not effective because using warm clothes to the chest does not help, will not help the child. But people have used certain things like covering, using inhaling steam, okay, is to decongest the airway, okay? So that may be of help, but the main thing is that once a child has such symptoms, it is better to see an expert like the pediatrician to look into the airway either to prescribe an appropriate antibiotics, and also if there is polyps, these polyps can be removed. If it is adenoid, you can do adenoidectomy. If it is due to tonsil, then the tonsillectomy can be done. But you need to see an expert. We have seen there are certain people doing this our local removal of tonsils, and I've lost quite some babies that were taken into this, developing complications because of using an unsterilized equipment to remove these things. The throat gets infected, and it becomes very difficult for me as an anesthetist to be able to put a pipe to connect the upper airway to the lower airway for that child to have oxygen. And therefore, that child, many of these children died because of inability due to distorted anatomy or destruction of the upper airway. So when a child has upper respiratory tract infection, the appropriate place to go is to first of all see a pediatrician. A pediatrician, if he says, then can refer to ENT if it is beyond the use of antibiotics.
Okay, thank you so much. So we have just a few minutes to end this program. And, I know we started by talking about, common cold and how this relates to, surgery and what are the things that we need to worry about. Now, the last question I'm going to ask is around, as an expert, what do you've told us quite a lot of things and we've grabbed so much of it, but I want you to just say it in like a box. What do you do to treat patients? I know we have 2 weeks. Let's say you've seen them, you want to send them home. What do you advise them within these 2 weeks to do to make things easier for them to come back?
As an anesthetist, you don't just cancel a case. There should be communication between you and the surgeon. Okay? And communication between you and the parent or the caregiver of that child. They need to either postpone that surgery or to go ahead. Okay? If you are to go ahead, you must also discuss about the implication of going ahead if you think that it's mild. Okay? Or even if it is a severe one, if it comes as an emergency, okay, you have to tell them the risk that is involved. So that when this child, because that child may need ICU admission, okay, after the surgery. So you've got to give them a written and informed consent, okay, even at cancellation and also at going ahead with the procedure. Okay.
Thank you so much. And on that note, we're going to end this edition or this episode of Monitor Your Health. To our viewers, thank you so much for always staying, there for us, because without you, we don't have a program. And our goal is to enlighten you on things that we know might be useful. And I hope that this edition has actually, helped. If it has helped, please, can you share this video? And also try to get more people to watch this if they've been valuable to you. Let us get your comments. Let us know how you feel about it. If there are questions you have, if you just post them below, we'll be able to catch it and run with it and get the right specialist to come and address your concern in that sphere. So thank you so much. Thank you, Dr. Oyedepo, for your time. We know that you are busy, and then you have actually given us, your time for this enlightenment, which we believe will go a long way. One way, so saving somebody's life somehow, somewhere, someday. Thank you so much.
Thank you. You are welcome, Dr. Femi Ogunremi. And I want to also thank the Establishment Monitor Healthcare for inviting me on this media to be able to educate our people about their health. And I say more grace to your elbow and greater heights in Jesus' name. Thank you very much.
So much. So tomorrow, for our viewers, we have an episode on panic, anxiety, and how that relates to your health. We have a psychiatrist and a psychologist coming on. It'll be 5 o'clock tomorrow evening. Thank you. See you then. Bye-bye.